Hello and welcome to Tower Hamlet's Talking Therapies What Is series. This video is going to be having a look at what is obsessive compulsive disorder or OCD. To be covered, we will be having a look at what is OCD, how common OCD is, some examples of different OCD symptoms, the vicious cycle of OCD, and how OCD is treated. What is OCD? OCD is an anxiety disorder with two main symptoms. People experience distressing and intrusive thoughts, and we call these obsessions. As a way to manage these obsessions or thoughts, people with OCD then carry out particular behaviours, and we call these behaviours compulsions. Let's have a look into obsessions in a little bit more detail. Obsessions are the thoughts, images, impulses or urges that people might experience. These obsessions are unwanted and can be quite frequent and unpleasant and usually cause a large amount of distress or upset to the person experiencing them. And these obsessions are often about the last thing the person would ever want to think about or want to happen in their own life. For example, my house will burn down in a fire, my house will be robbed. Now let's have a look at compulsions in a bit more detail. As a result of the distress that the obsession causes, a person with OCD carries out a compulsion to reduce this distress, such as hand washing, checking that the door is locked multiple times, checking that the hob is turned off, counting in multiples of 3, praying, repeating certain phrases over and over in their mind. People often avoid things that they know cause their obsessions and compulsions, which can lead to a restricted life. It can take a long time to get things done because checking can take up a lot of their time. How common is OCD? OCD affects 1 to 2% of the population. OCD symptoms often appear early in life, such as in childhood, the teenage years, or even early adulthood. Males and females of all races are equally affected. OCD can get better or worse over time, and sometimes the symptoms can flare up in response to life stresses. On average, it takes 10 years before people with OCD seek help. We will now look through a couple of examples. Somebody might touch a dirty surface and have an obsession or a thought, such as, I'm contaminated and I will fall ill. As a result, they might carry out compulsion, which might be washing their hands 3 times to ensure that all germs have been killed. Another example might be that somebody's left the house for work, and they may have the thought or the obsession that they've left the cooker on and the house will burn down, and understandably that will cause a large amount of distress to that person. And as a way to manage that distress, their compulsion might be going back to the house and checking that the cooker is turned off multiple times before trying to leave the house again. OCD can have many different themes. Some people might have fearful thoughts about being contaminated in some way by dangerous substances, and we saw this in the first example. Other people might have thoughts about things in their life not being in the right place, and they can find this quite upsetting. Others might have thoughts about their sexual identity and preferences. Some people might have frightening thoughts or images that a serious or harmful event will occur because of their carelessness, and we covered this one in the second example. Some people might have pictures or thoughts that they will harm other people accidentally, especially those close to them, and that they wouldn't want to hurt. And finally, another theme might be about hoarding. People can experience one or more of these different themes. The vicious cycle of OCD. We can become trapped in a vicious cycle of OCD. Having an obsession can cause distress and anxiety. and as a result, we may carry out the compulsion as a way to try and prevent the bad thing from happening, and this can provide us with a bit of short-term relief. For example, touching something dirty and having an obsession about becoming ill understandably causes anxiety, and therefore we may wash our hands 3 times to prevent ourselves from becoming ill. This gives us some short-term relief. However, the next time we have a distressing obsession, we feel as though we have to carry out the compulsion because we have learned that this provides a bit of short-term relief. However, we therefore become trapped in this vicious cycle. People get no pleasure from doing these things and can sometimes forget the reason why they started doing it in the first place. How is OCD treated? The most effective treatment is cognitive behavioural therapy, or CBT. CBT focuses on how our negative thoughts and unhelpful behaviours can impact how we feel. Therapy would usually start with understanding more about your OCD, such as what your triggers are and what maintains your symptoms. The aim of CBT is to help people manage and overcome their OCD by teaching practical skills and techniques. In summary, OCD is a common mental health disorder. There are 2 main symptoms: obsessions and compulsions. OCD can cause a large amount of distress to the individual experiencing it, and CBT is an effective treatment option for OCD. It helps you to understand more about your symptoms and triggers and ways to manage your distress.